From Trauma to Triumph. Navigating mental health as a survivor of domestic violence. Domestic violence is a pervasive problem in the United States, with 1 in 4 women and 1 in 9 men experiencing intimate partner violence in their lifetime. Survivors of domestic violence often face numerous physical, emotional, and psychological challenges, including a higher risk of developing mental health problems. Let's explore the mental health problems that survivors of domestic violence commonly experience and discuss the importance of seeking help and support. Post-traumatic stress disorder, PTSD, is a mental health condition that can occur after a person experiences or witnesses a traumatic event. Survivors of domestic violence may develop PTSD due to the physical, emotional, and psychological trauma they experienced. Symptoms of PTSD can include flashbacks, nightmares, avoidance behaviors, and hyperarousal. PTSD can be effectively treated with therapy and medication, and survivors of domestic violence should seek help from a mental health professional to manage their symptoms. Depression. Survivors of domestic violence are at increased risk of developing depression due to the trauma and stress of the abuse they experienced. Symptoms of depression can include feelings of sadness, hopelessness, and worthlessness, loss of interest in activities, changes in appetite and sleep patterns, and difficulty concentrating. Depression can be effectively treated with therapy, medication, or a combination of both. Survivors of domestic violence should seek help from a mental health professional if they are experiencing symptoms of depression. Anxiety. This is another common mental health problem experienced by survivors of domestic violence. Anxiety disorders, including generalized anxiety disorder and panic disorder, can develop due to the chronic stress and trauma of domestic violence. Symptoms of anxiety can include excessive worry, restlessness, difficulty concentrating, and physical symptoms such as heart palpitations and sweating. Anxiety can be effectively treated with therapy, medication, or a combination of both. Substance use disorders. Survivors of domestic violence may turn to drugs or alcohol as a way to cope with the trauma and stress of their experiences. Substance use disorders can develop as a result of these coping mechanisms. Substance use disorders can have a significant impact on a person's mental and physical health, and it is important for survivors of domestic violence to seek help from a mental health professional if they are struggling with substance abuse. Borderline personality disorder. Some survivors of domestic violence may develop borderline personality disorder, a mental health condition characterized by intense and unstable relationships, self-image, and emotions. Symptoms of borderline personality disorder can include fear of abandonment, impulsive behavior, self-harm, and mood swings. Borderline personality disorder can be effectively treated with therapy and medication, and survivors of domestic violence should seek help from a mental health professional if they are experiencing symptoms of this condition. Survivors of domestic violence often face numerous physical, emotional, and psychological challenges. Mental health problems, including PTSD, depression, anxiety, substance use disorders, and borderline personality disorder, are common among survivors of domestic violence. Seeking help from a mental health professional is essential for managing these conditions and improving overall well-being. If you or someone you know is experiencing domestic violence, there are resources available to help. The National Domestic Violence Hotline, 1-800-799-7233, is available 24/7 to provide support and assistance to survivors of domestic violence. Thanks for watching. Please like, share and subscribe.